What do you see now?
Yep, we're good.
Oh, well, I'm happy to hear that, and I apologize for the technical difficulties. But I am going to talk to you about the Sun Project, and the Sun Project is a cross-sector collaborative working to serve pregnant and postpartum women with perinatal substance use disorder. The beginning of this project really started at the Cabarrus Health Alliance. We have a high-risk maternity clinic, have had that clinic for many years back to 1994, 95, and have always served women with any kind of high-risk condition, and we always thought about substance use disorder and mental health disorders as being high-risk perinatal conditions. Some of you may recall that we began a pregnancy medical home initiative back in 2009. The overall initiative, I think, started. And then in 2011, Dr. Russell Suda, who was at that time our medical director, became the champion for that program. And so they were working on a variety of different pathways of clinical care that were best practices across the state. And in 2015, substance use disorder came up. And Dr. Suda would readily tell you that he practiced before he came to us in a private practice in Washington State, and often felt like, as a single OBGYN with a partner, just the two of them trying to serve women, that when it came to social issues or mental or behavioral health issues, he felt like a fish out of water. So when they started in 2015 to create this pathway, and they started looking at all the different points of care that someone needed if they had a substance use disorder and were pregnant, they ended up with, I think he tells the story to be like 15 pages of this pathway, where the other pathways were 2 to 3 pages in length. And he and I sat down at that time and he said, Sonia, you and I've been doing this work. I felt like we were really doing good work, certainly better than what I was able to do by myself. But we need partners. We need more people to come to the table to really be able to meet all these needs, because women need social services, they need transportation, they need help with childcare, they need job placement, they need everything. And so between 2016, from that time in 2015 till about 2017, 2018, we were really meeting with people who were doing some of this kind of work. In particular, in Gastonia, they were doing this work with a program they called STARS. We went out, we talked to them, we brought people in to talk to us. We were beginning to convene partners. But Dr. Suda and I are both providers. So I'm a licensed clinical social worker. My specialty practice area is in the peripartum period with women and families. And he, of course, is an OBGYN, busy seeing moms and delivering babies. And so he started talking to me about, we need somebody to drive this work. Somebody who can get partners to the table, can schedule meetings, can set up meetings with individual partners and with big groups. And so we started writing grants at Cabarrus Health Alliance, but we wrote a lot of grants related to this project and didn't receive any funding at that time. But Ann Benfield was interested in this work because she realizes, as most of us do, that babies can't get a solid foundation that they need if moms don't have a solid foundation on which to parent them. And so she talked with her board at the Cabarrus Partnership for Children, and they decided that they would be willing to support her in seeking out funding to support our project. So we got some initial funding through the Cabarrus Partnership for Children, and eventually in 2019, Gina Hofert was hired to come on and coordinate the project work. So we did a lot of community collaborative work, did a lot of investigation around SAMHSA's best practice model in this cross collaborative approach. And in 2019, eventually named this work the SUN Project. SUN at that point was Substance Use Network Project. Not very creative necessarily, but we did that as a group of interested Cabarrus County, few folks from Rowan County came together to do that initial work. And then our clinic had just been the high risk clinic for all these years, but at that time we named it the Sun Clinic. And so that's how we actually came to this work from a named perspective. The components of our work include that we have legally binding memorandums of understanding with multiple partners, which I'll share some of those partners in just a minute. And we have a legally vetted release of information that is shared across all of those partners. So when a woman comes into any one of these agencies, she's able to, and says, "Hey, I'm pregnant and I'm using substances," or she comes in and she's screened and we find out she's pregnant, or screened and we find out she's using substances, then any one of those partner agencies can present her with the shared release of information, explain to her what our project is and how we work together to coordinate care for women. And they can sign on to be part of the project. And they may or may not choose to be served in the Sun Clinic to receive their OB care there, but the majority of women do. In 2022, or excuse me, in 2020, we began monthly care coordination meetings, which were allowed by this legal framework I just discussed with you. And that is where all these partners come to the table and we have open case consultation each month. In 2022, we realized that the Department of Social Services Child Protective Services divisions had laws that, even though we had our legally binding MOU, even though we had had multiple attorneys at the table, and we had these releases of information signed, that they had a law that still prevented them being able to fully communicate openly with the rest of the partners. And so at that point, we took strides to obtain judicial orders to be able to do that sharing. At that same time, we were expanding this work into Rowan and Cabarrus, excuse me, into Rowan County to add to Cabarrus. We've always had clients coming from Rowan County, but we were beginning to increase the partnership with our Rowan County partners, expand the number of partners that we had. And then just in end of 23, beginning of 24, we were able to bring Stanley County into our partnership as well and started hosting 3 separate care coordination team meetings that were county specific in order to open up the number of partners at the table, but minimize the amount of information that people were hearing that they may or may not need, since women weren't necessarily in those counties. So here's a list of some of our partners. Some that you may find a little bit more unusual than others are our DPS and EMS partners. But EMS and community paramedic programs have really gotten involved with assisting with individuals with opioid use disorder and being able to provide medication for opioid use disorder in the form of buprenorphine. And then, of course, our detention partners and probation partners are very important in working with many of our clients. So I'm going to stop talking for just a minute and let you guys process this very busy slide, and then I'm going to come back and talk a little bit about it. What you can see here is a visual representation of the work that we did over that timeline that I just presented in terms of setting up the system that allows this work to take place. Primarily here, I just want you to take note that mom and baby are at the center of this collaboration. So there are multiple organizations that are involved, and Cabarrus Health Alliance and our clinic overlaps with most every woman, but CHA is not the center of this work. Moms and families are the center of the work. We have taken an approach that works both at the systems and at the direct practice level. So building this system of care across 3 counties has meant really having direct, honest, and sometimes a little bit, conflictual conversation or difficult, not conflictual, difficult conversations, because sometimes it's easy to start to think about, "But wait, that's my client, and if the client goes there, maybe I won't get the funds that I need for the client here." And so many of us had to put that aside. Sometimes we think about when we came together to have these conversations, we had to provide feedback that maybe clients expressed that they didn't want to go to particular providers because they didn't feel they were getting the care or the respect that they wanted from those providers. And so we all had to come together, make ourselves vulnerable, be willing to listen, be willing to obtain more training, to learn more things, to help us remain rooted in a trauma-informed, harm reduction focused, um, compassionate approach to care. So we were doing that systems work. We realized that Dr. Suda was doing this work. He was providing buprenorphine to women who were pregnant. He had learned that. He would say, I didn't come into OBGYN as a substance use provider, but I had to begin to provide what my clients needed. So provider training became part of this. Throughout this, evaluating, is our work being impactful? Advocacy, trying to bring funds into the county in order to continue this work. Listening to individuals with lived and living experience. Having our peer support specialist at Cabarrus Health Alliance work with women to give them an opportunity to voice their needs, concerns, thoughts about how services were being provided. And then, of course, guys, I apologize for the crazy dog you hear in the background. Of course, I indicated earlier on that we were using a SAMHSA model of cross-sector collaboration, and we continue to do that. And then, as you can see across the bottom, everything about our legal framework, taking into account 42 CFR Part 2, HIPAA, social service regulations, and then all the different policies and processes of each subsequent organization. So lots of attorneys looked at our work as we moved our systems work forward. But why did we need a clinic? Why was this work important in the beginning? Well, this is really because when pregnant women, when women find out that they're pregnant and they're using substances, it's an opportunity, it's a crossroads oftentimes of, I want something different for my baby. And many women come to us and say, I really want to stop using. I want to change my life. I want to be able to keep my baby. They're already coming in for prenatal care, and it's a prime opportunity in the same location to offer the service that they need. Because one of the things that we noticed within our clinic was that sometimes women would show up and deliver a baby and would not have had any prenatal care, but they were going to a methadone or a buprenorphine clinic, but they weren't getting prenatal care. Or they would deliver a baby and they were getting prenatal care, but they hadn't received any care to treat their substance use disorder. So we thought, why not bring those two things together? So the clinic was developed to have a comprehensive care model that within the clinic is interdisciplinary. This is beyond the cross-sector external work, but within the clinic, it's interdisciplinary. It's trauma-informed, culturally humble, client-focused, and rooted in harm reduction. And we focus really hard to ensure that our physical environment is safe and inviting for women so that they will come initially and that they will continue to come back. So in our clinic, we have an OBGYN, we have a family practice doc, and we have nurse practitioners, including a psychiatric nurse practitioner. We have on-site ultrasound lab and fetal monitoring. We, of course, do offer buprenorphine, mental health and substance use services by licensed providers on-site, nutrition counseling by a registered dietitian, case management service, various different recovery supports to help women continue their recovery journey, peer support specialist. The WIC program is in our office. We have dental care on site, but not only on site, but on the same floor at same time service. And then we have newborn care with pediatrics in the same clinic with us. So how's this program been working? Well, 85 women, more than 85 women, have been enrolled in the Sun Clinic to date. 95% of those women who enroll in the program remain in the program at delivery. 95% have delivered at greater than 35 weeks. But the average age of delivery is 38 and 3/7 weeks. We had 3 early preterm births, and that means that it was 36 weeks or, yeah, 35 to 36 weeks. 1 premature birth in 2019, since 2019, and we've had no maternal or fetal deaths and no severe morbidities among the babies that we have delivered. We are super excited about the work that we do and really happy to share it with you. In addition to the work with the Sun Clinic, about 2.5 years ago, we realized, well, maybe 3 years ago, we realized that one of the things that we knew, of course, is that women do not exist in isolation. They have families and they have friends. And many of the family members and friends also use substances. And so women would come to us and they would say, my partner really needs care. My mom really needs care. My sister, my roommate. And so we were able to write a grant to Department of Justice and sorry, this grant has about 5 different names. I'm trying to make sure. It is a Department of Justice grant, and it's a COSUP grant. And so it's to address opioids and stimulants. And we expanded our clinic to what we now call the RISE Clinic, and it serves women after the first year postpartum and then non-pregnant women and men. And so we have been able to continue to serve the women that start with us in the Sun Clinic and continue to serve them and continue to host monthly care coordination meetings where we discuss their needs and partners are able to respond to those needs in real time. And we've been able to serve other members of their family. I am going to stop sharing and have an opportunity if anybody has any questions for me.
Sonia, thank you for that presentation and just speaking about the wonderful services that the Sun Projects provides, and then also the RISE Clinic as well. Anyone, if you would like to just open up the conversation, maybe about some of the work that you all do, or if you have questions, please feel free to unmute or you can utilize the chat.
Hey, Sonia, it's Rob Harris. On the Rice Clinic, what services do you offer there? And is that through the three
Okay.
counties as well? Is that just Cabarrus County?
So it's through those three counties, but I'll tell you, our Sun Clinic and our Rise Clinic, we serve folks from Mecklenburg, Davidson, Iredell, Union, all over the place. And the same is true with the Rise Clinic. But we do have a primary population of Cabarrus, Rowan, Davidson, Mecklenburg, and Stanley. In that clinic, we kind of have dubbed that a wellness-based clinic. What that means is that we address not all primary care issues. We're not a full primary care program, but we do address sexually transmitted infections, HIV, Hep C, wound issues, nutrition issues, dental. So things that are more acute and commonly related to commonly present with individuals who use substances. We have that same dental is on site, nutrition is on site, lab is on site. We also had a harm reduction wellness clinic. So sometimes people come to us for a syringe service program or to be seen in our wellness, our harm reduction wellness service. Those services are provided on site in Kannapolis at our CHA building, but in cooperation with our community paramedic program. So that sometimes clients come in there and then make their way up to the RISE program. We also have peer support specialists and licensed clinical social workers and addiction counselors in that program. Another really great thing about the RISE program is that through that grant funding, we are able to serve individuals, and we have a large number of individuals coming out of detention to us. We get them directly into care from a warm handoff from detention, and we're able to pay for their medication until they're able to get employment, get enrolled in Medicaid, and are able to be more sustaining. We actually have a cost sharing program that lasts over a year, but since Medicaid expansion, we've been super excited to be able to get most of those clients enrolled in Medicaid pretty quickly.
And Sonia, I just wanted to say I have written down in my notes the two slides that spoke to me the most. Your project partner slides that just talked about all the partners that are involved in the project. And then also building a system and just being able to see visually how the system works. And then also just appreciating the barriers that were shown, like the hurdles that were on there and the gates. And then also recognizing the need for system level change as well. I think that's very important whenever we're speaking about systemic issues and realizing that there also is a level of system change that is required as well.
Absolutely. I think one huge systems issue that I know we're all probably aware of is the intersectionality of all the bias the individuals who use substances. So if you think somebody who uses substances is pregnant, uses substances and has been in detention or incarceration, that's unemployed, that may be homeless, all of that. And just such a huge opportunity for systems change.
Absolutely. I see a question in the chat asking if the slides will be available.
I'm happy to share the slides.
Okay. You can send them to me and I'll be able to send them out to everyone. Before we conclude, I did just want to give space to if anyone wanted to come off mute and say anything, or if you wanted to say anything in the chat. And also, I'll point out that Krista, she put the Cabarrus Health Alliance website in the chat. Through there, you can access information about the Sun Project. and also if you would like to connect with Sonia.
And I will share when I send the slides, a card, an informational card about both the Sun and Rise clinics, in case anybody wanted to make a referral or wanted additional information.
Definitely, thank you. So we are ending a bit early today. We usually go right to time, but since we were down 2 speakers, we'll go ahead and conclude for today, and I
I
will
have
pass the.
I have one last question. I'm sorry.
Oh,
Sonia,
absolutely.
on the Rise Clinic, is that normal business hours, 5 days a week? How's that? What's the hours?
So we do have appointments, and we have been 5 days a week up until just last week. We had a provider change, and so right now we do not have clinic on Friday, but we're working on reestablishing that. But currently it's 5 days a week.
Thank you.
All right, well, I'll pass it to Krista Moore. She's going to give us our closing.
Thank you, everyone, for joining us today. We appreciate the presentation from Sonia. Next month, on Wednesday, October the 23rd at 10 a.m. for the next community cafe, our discussion will be on depression and suicide. So we look forward to talking about those two really important topics and being able to give you guys some information and some resources for those two topics. So thank you again, everyone, for joining, and enjoy the rest of your day.
Thank you.
Thank you. See you.